In this video, I will talk about liver cirrhosis follow-up tips. I will share with you my memoics for you to remember. The liver is located in the upper right-hand portion of the abdominal cavity, beneath the diaphragm and on top of the stomach, right kidney, and intestines. Microscopically, the organization of liver tissue can be represented by different schematics. One of the examples is the classic hepatic lobule, which is organized as hexagons, with the central wing in the center of the lobule, and at the corners of the hexagon are portal tracts, which consists of the hepatic artery, portal wing, and the bile duct. It looks like a beehive. However, our liver structure is 100 times more complicated than that. Chronic liver injury causes inflammation, resulting in distortion of liver tissue and vascular architecture, and collapse of liver structures. At the same time, healing occurs and can lead to the formation of fibrous septa and nodules. Take hepatitis B as an example. The natural history of hepatitis B, the fluctuating serum enzyme concentrations and viral level in the graph, demonstrating the immune clearance phase in hepatitis B patients. When the alternate processes of inflammation and healing occur repeatedly, scarring, fibrosis, and cirrhosis develop after a long period of inflammation that results in replacement of the healthy liver tissue with fibrotic tissue and regenerative nodules. There are some complicated ways in staging fibrosis or cirrhosis. For example, by symptoms, blood tests, ultrasound, transient elastography, liver biopsy. However, in the clinical situation, I would suggest to use simpler method by asking oneself two questions. 1. Any liver cirrhosis? And 2. Any liver cirrhosis complication? Then classified into no cirrhosis, compensated cirrhosis, and decompensated cirrhosis. Decompensation being defined by the presence of complications in liver cirrhosis, namely ascites, hepatic encephalopathy, or esophageal variceal bleeding. Most patients with cirrhosis remain asymptomatic until the onset of decompensation. My tips are that liver cirrhosis beats people through complications. In taking care of patients with cirrhosis, I suggest the management goal by considering the past, present, and future of the liver cirrhosis. For the past, to treat the cause and to prevent other causes for further liver injury. Concerning the present, search for any complications, manage them, and delay them if possible. For the future, carry out surveillance for liver cancer and esophageal varices, determine the prognosis, and assess suitability for liver transplantation. First, I would like to talk about the cause. There are many things that can cause liver injury, hepatitis, and liver disease. I use MADE-BV as memoics. M. Metabolic. A. Autoimmune and alcohol. I. Infection. D. Drugs. B. Biliary. And V. Vascular. Some of the causes may cause chronic injury resulting in liver cirrhosis. The common ones are non-alcoholic fatty liver disease, alcohol liver disease, hepatitis B, hepatitis C. In helping patients with liver cirrhosis, we treat the underlying cause and prevent other causes of liver injury. Some of the causes are treatable. For example, some genetic diseases like Wilson's disease, hemochromatosis, autoimmune hepatitis, viral hepatitis like hepatitis B and hepatitis C. When patients ask me what to avoid in liver disease, I advise to avoid three things. First, no alcohol intake. Second, avoid eating raw shellfish or pig liver. 3. Discontinue any non-essential medications and supplements, and consider vaccine like hepatitis A or B. In a 2021 Brazil study, 46 references with a total of 936 cases reported were reviewed. They found 79 types of herbs or herbal compounds related to herb-induced liver injury. Liver transplantation was necessary for 6.6% of these cases, and deaths were observed in 10.4% of the cases. In 2018, a group of China doctors developed clinical guidelines for the diagnosis and management of herb-induced liver injury. Supplements can cause severe hepatotoxicity that can have variable clinical, laboratory, and histological phenotypes. LiverTox provides up-to-date, unbiased, and easily assessed information on liver injury attributable to drugs, selected herbal and dietary supplements. The LiverTox site is meant as a resource for both physicians and patients. A group of international liver doctors, including Professor Lai Qinglong, showed that the majority of hepatitis B patients who were treated with long-term entecavir therapy achieved substantial histological improvement and regression of fibrosis or cirrhosis. A review article in 2013 stated that hepatic fibrosis improves in 53 to 57% of corticosteroid-treated patients with autoimmune hepatitis. Progressive fibrosis slows or is prevented in 79%, and cirrhosis may be reversed. Then I will talk about present, the complications. I use the word BEATS, B-E-A-T-S, to remember the complications of the liver cirrhosis. B. Bleeding varices. E. Encephalopathy. A. Ascites. T. Tumor. S. Systemic syndrome. These complications can be identified early in the follow-up by upper endoscopy, clinical, blood tests, or imaging. Some of the severe form or complications can be preventable and treatable. For example, variceal bleeding can be managed by medications, and endoscopic band ligation. E. Encephalopathy can be managed by nutritional support, and medications like lactose or rifaximin. Ascites or infected ascites can be managed by diuretics, antibiotics, and tapping. For the tumor, early stage tumor can be treated by surgery. Then I will talk about surveillance and prognosis. Thinking about the future, to carry out surveillance for liver cancer and esophageal varices to determine the prognosis and assess suitability for liver transplantation. Patients with cirrhosis are advised to undergo endoscopic surveillance for varices to identify candidates to primary prophylaxis against variceal bleeding. In patients with cirrhosis, surveillance for liver cancer is recommended every 6 months through ultrasonography. Child-Pugh score and model for end-stage liver disease (MALE) score should be used to identify prognosis, including mortality risk. The Child-Pugh score uses serum albumin, bilirubin, prothrombin time, ascites, and hepatic encephalopathy to classify patients into classes A, B, and C. Patients in class A generally have compensated liver cirrhosis and are at low risk of mortality. The MALE score uses the objective variables of serum bilirubin, international normalized ratio (INR), and serum creatinine to calculate a score ranging between 6 and 40. The higher the MALE score, the greater is the risk of mortality. Patients with a MALE score of up to 12 are at very low risk of mortality at 3 months, even with major surgical procedures. Liver cirrhosis follow-up tips. In the clinical situation, I would suggest to use simpler methods by asking oneself 2 questions: any liver cirrhosis, and 2, any liver cirrhosis complications, then classified into no cirrhosis, compensated cirrhosis, and decompensated cirrhosis. After cirrhosis is confirmed in a patient, I suggest the management goal by considering the past, present, and future of the cirrhosis, by tackling the causes, managing complications, and to reduce death. My memorics are MADE BV beats cirrhosis. Some of the causes are treatable or preventable. I would like to advise the liver cirrhosis patients not to take alcohol, avoid eating raw shellfish or pig liver, discontinue any non-essential medications and supplements. The complications of liver cirrhosis are identifiable, preventable of severe events, and treatable. Child-Pugh score and MALE score should be used to identify prognosis. This video provides a brief introduction to liver cirrhosis. In fact, every complication or cause mentioned is a big topic of distinct disease entities, having different guidelines supported by thousands of clinical experience and scientific experiments. Recommendations for further reading. For mild reading, I suggest to go to Center for Health Protection of Hong Kong, which provides both English and Chinese versions for cirrhosis of liver. For moderate reading, I would suggest an article from American Family Physician in 2019. If you like this video, kindly help to comment, like, and share. Thank you.